Hello, hi, I'm Zanzi, and welcome back to the Health for Mzansi podcast, episode 94, proudly brought to you by Health for Mzansi. I'm your host, Joe, and I'm excited to walk this health and wellness journey with you. Remember, nothing is off limits. For the month of June, we will be exploring the different professions in the medical field. And for episode 94, we'll be chatting to Nompumelelo Blakfesi, but for this chat, Sister Blafesi, who is a midwife currently working at Mowbray Maternity Hospital with an 8-year experience. I'm so excited to get into this chat and hear about Sister Blakfesi's experience of being a midwife in South Africa. Sister Blakfesi, how are you doing?
Joanne, I'm good, my darling. How are you?
I'm doing well, thanks. What is the role and responsibility of being a midwife?
Joanne, I'll start with the roles first of a midwife. The roles are to provide evidence-based care to pregnant mothers, to help mothers make informed choices about options and services available throughout pregnancy. For example, home birth, medicated birth, for example, epidurals, for example, analgesia like morphine and pethidine. The responsibilities are to provide full antenatal care, which includes antenatal classes, monitor and support them during labor, and to ensure a healthy pregnancy and safe delivery, clinical examination, e.g. to identify high-risk pregnancies, e.g. mothers who have blood pressures, the other high-risk mothers who are diabetic, etc., etc.
Sister, I want to ask you, you mentioned, that you provide information and guidance to the pregnant mother. So I'm assuming that this information gets given before the mother gives birth. When do you start giving this information?
On their first visit, all this information, and as time as they're visiting us, give this to make sure that we are preparing them to give birth.
Sister Blafesi, I know that you have about 8 years experience in the field, but to become a qualified midwife, what is the process in terms of getting qualified and being suitable for the role?
You must be registered with SANC, firstly as a student through college or university, then practice as a student to accredited hospitals and clinics. Once all the SANC competencies have been completed, you get registered as a midwife.
Is there any practical process that you have to follow after you obtain your qualification?
Like as a midwife? No. Besides the trainings that they send us, just for updates. The other thing is when they can take you for advanced midwife, then that's something else.
Is that after a certain number of years?
Yes. As long as they can send you. After a certain number of years, when you have experience, then they can send you to school. For
advanced. In your 8-year journey and 8-year experience, has there been any misconceptions by patients or by people that's outside of the medical field about midwives?
Community do not believe that midwives are not skilled enough to care or monitor. So patients get the same conception from the communities or public.
What you just raised now about patients or the community not believing that midwives are skilled enough, would they rather want to be seen by a doctor or by a nurse?
That's a lot. And even their birth companions, when you come as a midwife, and you can see their facial expression, they don't trust you. Up until you're there, you try to talk to them, and then you do what you're good at and the best. And then after you deliver the baby and everything is fine, is okay, then they can see.
Then you're the best.
Sometimes they will ask you, Sister, can the doctor deliver my baby? Because our doctors are coming in and around. They will tell you, the doctor was here and she said she's coming back. So that means they don't believe you and they don't believe in you and they think that you cannot, up until you do your best, and then they'll like, wow. All that.
Is this as a result of a lack of information or education?
It is a lack of information and education. It is because that you see this one has got a full information and she's got a knowledge of what is going on. You don't see any problems. They know that this is a wife, she can deliver my baby. It's a lack of information, I can say, Joanne.
So, sister, if I can ask you, what are some of the challenges that you have experienced as a midwife?
The challenges that we experience a lot is lack of resources. It's also the short staffing and also not being appreciated by the patient and our management.
Do you think this is something that needs to be raised by midwives themselves? How can we find a solution to these challenges?
For us to raise these challenges and speak up, we've got meetings that we have, whatever time we have them, but we need to talk about these things. These are the challenges that we are facing.
And sister, just lastly, I've noticed that there's quite an increase in young mothers going the route of home births and having midwives come over and walking that journey with them. What do you think is the reason for more people opting to kind of do home births and to rather have a midwife there instead of going to the hospital?
Some of the mothers, because of the experience they get from hospitals, staff being rude, some mothers now they want to experience the natural birth unassisted and to just appreciate how great their bodies are. Some of them, they don't want scissors, they don't want instruments, they don't want analgesia, meaning pain stuff. They just want to do it natural.
Sister, would that be something that you would encourage with the support of a midwife?
Yes, and that's what we are supporting our mothers. Some of them, they will come and then, I want scissor. As you talk to them and explain to them the dangers and the beautiful of having a natural birth, then they want to do this because when you explain to them nicely, then they want to do this natural births.
Thank you for joining this week's episode of the Health for Mzansi podcast. For more on our midwife chat, check out healthformzansi.co.za. Now remember, if you are in a medical jam or just curious about some health and wellness trends, you can send an email to hello@healthformzansi.co.za or send a WhatsApp to 076 132 0454. Yeah, we're on Blue Tick. So there you have it, gals and guys. Professions in the medical field are varied and all have their specialities. Let us not forget to show our midwives some love for their roles of support and dedication to delivering our children. Till next time, keep well and stay healthy. Signing out, your girl Jo.